But talk about your pain, can't appreciate the sun without acknowledging it rains, right? That's right. So this a moment of clarity. Be clear. And make sure you always protect your energy. You stay focused and your life gon' be lit. And you are now rocking with Celeste, the therapist. Let's go.
Hello. Okay. Hi, everyone. If you're watching me on the replay, thank you so much for watching me. I appreciate you. I just want to make sure I'm on my mic really quick. Audio. I was not on my mic. Is the mic's plugged in? Why is it showing up? Audio. Okay, there.
No big, I feel like Pac. I shoot a shot. I'm coming in hot.
6 years. I've been podcasting for 6 years, and I started July 2nd. Why is it laggy? Okay. I started July 2nd, 2018, and I have been doing it literally every week during the pandemic. I would do it 5 days a week, which is why I'm up to like almost 500 episodes, because I've never missed a week, never missed a beat. So I'm so excited. It's been extremely successful, helpful for so many people around the world, which is exciting, which was my plan when I first started. So last week we discussed managing the complexities in relationships. Thank you so much. We talked about that. And so that episode is up and is streaming live on all podcasting platforms and also on social media. Today we're talking about anticipatory anxiety. And so I love teaching. And so, I got slides for you. So if you're listening to this on the audio and you want to check out the slides, you can just go to YouTube, Facebook, or YouTube or Facebook to find it. Just search Celeste, the therapist, and you will find it. So before we talk about anticipatory anxiety, I just kind of want to share when I wrote it what people. So I actually did a short. I should probably pull up that short. I did a short about anxiety and what it is. And so I'm going to pull it up and share my screen. And if you are not following me on TikTok too, you can follow me on TikTok. But I'm going to share my screen, share screen. TikTok. Okay, here it is. All right, so let's share what I said. All right, have you ever heard of anticipatory anxiety, also known as future tripping? But before I share that, my name is Celeste. I'm a therapist from Boston, and my goal is to help shift the way you think. So if you are feeling stuck in life, my platform is for you. Anticipatory anxiety is literally what it is. You're anticipating something in the future, which is why it's also called future tripping. Now, this is when your mind becomes preoccupied and worried about future events. This can last for hours, weeks, months. Now, what's happening is your mind starts to become preoccupied with things in the future. What happens when you are so preoccupied with things in the future, you literally will miss out on the moments of life. Now, staying in this state can continue to allow you to have mental and physical symptoms, in the name of few. Emotional up and downs. Even sometimes numbness may be a symptom of anxiety, difficulty concentrating, and even some physical symptoms. A lot of times people with the physical symptoms tend to have some GI issues, nausea, back pain. For me, I experience back pain when I'm feeling overwhelmed and anxious. Let's talk about what you can work on doing about it. One, I would challenge you to start to reframe what anxiety looks like for you, where you ask yourself, what are you trying to tell me, body, as opposed to looking at it as this big dark cloud over you. When you do that, it has less power. 2, try to start practicing mindfulness. 3, pay attention to what you're putting in your body, how you are moving your body. Really start to take good care of yourself. My last tip is to think about taking action and try with the small things. If you've been avoiding some things, if you've been avoiding some phone calls, if you've been avoiding some of your goals, try to start with accomplishing the little things, because what's going to happen is you're going to allow your mind to gain confidence about your ability to make things happen. When you aren't doing those things, the anxiety tends to win, because all you're doing is telling it that, you know what, you're right, this is too hard, or this isn't going to work, right? So start to take action and have a lot of grace with yourself as you're trying this out. All right. So that was the clip that I posted about anticipatory anxiety. So this is what some people are saying. I'm never present. I have to think about the future, because if I don't, my life will fall apart. And I do want to address that comment as well. I started telling myself each morning, I'm here one more day. Let's be in the moment, because I may be the last day, because if I don't speak to myself. Someone else says, yes, I experienced this when I lost my father. Every single day until Father's Day that year, I was overwhelmed with anxiety. I'm so thankful that was then. So it sounds like they've worked on that. Someone said, this is me all day. Someone says, absolutely, avoiding uncomfortable things makes my back hurt. And so I'm never present. I have to think about the future, because if I don't, my life will fall apart. A lot of people experience that, especially out of survival, feeling as if you have to always be kind of overly prepared for the future is unfortunately really common. So what is anticipatory anxiety? It develops out of an overactive imagination or from conditioned responses to memories. So it's important to note that this is not a medical term, anticipatory anxiety. It is something that develops out of fear or distress um, about something in the future. It can be a symptom of an anxiety disorder, such as obsessive compulsive disorder, social anxiety, which is huge, and generalized anxiety. So think of it like if a movie was playing in your head in a loop with those thoughts. That's what's happening. It's kind of like your mind is looping this fear over and over again and creating a lot of distress for you. So, what are some of the symptoms that people find themselves experiencing when they are struggling with this? And physical symptoms: rapid heartbeat, shortness of breath, trembling, stomach issues, muscle tension, chest pain, muscle spasms, and headaches. Some emotional stuff that you may experience is difficulty concentrating, irritability, which is big, restlessness, mood swings, emotional numbness, loss of interest in hobbies, and feelings of apprehension. Now, when I asked on my stories, asked people like what kind of symptoms do they find themselves experiencing, a lot of people, one of the common ones was stomach issues, right? GI, whether it's nausea, diarrhea, feeling like you have bubble guts, you're about to get in trouble. Some people said sweaty, grinding your teeth, uh, and head stuff, right? So there are so many different ways that people find themselves struggling with this anxiety, but also there's no one size fits all either. And I want to address like why anxiety is like common in the GI and your stomach area, so that you can be aware. I think that the more that you are knowledgeable about mental health and what's going on in your body, the better equipped you are to deal with it. Right. So I know that if I put my hand over the stove and a fire's on, I'm not going to keep putting my hand over the stove because I don't want to get burnt. Like I know that literally for the stove. When it comes to mental health, I don't think we like know what are the things we need to do because we're just like trying to survive and feel better, not recognizing like running from anxiety doesn't cure anxiety. Over preparing, is it going to make it better? So if you look at this for people that are listening, I'll read it. Why does anxiety cause GI problems? So anxiety, and you know, the stomach is looked at as like the second brain. I have to do another episode on that. A lot of gut health is so important because of how much it creates so much more turmoil if you're not healthy in the gut area. So anxiety can cause gastro issues because the body releases hormones and neurotransmitters in response to stress, which can negatively impact digestion. So these chemicals can interfere with gut motility, the balance of bacteria in the gut and gut flora, the microorganisms that acid digestion. So the chemical imbalance that's happening due to this stress can lead to a number of issues like indigestion, stomach cramps, diarrhea, loss of appetite, unnatural hunger, nausea, irritable bowel syndrome, and peptic ulcers. So when it comes to understanding how stress plays a role in your life, because remember, we can create stress just by us thinking about a situation. The situation doesn't even have to happen, right? The same way, like hunger, you ever been so hungry and you heard bad news or something bad happened, all of a sudden you're not hungry? Those stress transmitters go into our stomach, right? And it really can create a lot of harm. We can create a lot of harm in our gut just by thinking of a situation. So, what are some of the causes and triggers, right? So, when it comes to fearing about fear or fearing about the future, I want you to understand like why this happens, because if you're not aware that the mind is malleable, we are able and capable of reframing and shifting the way we think to create new avenues for ourselves. But if we don't know this, then we're not going to do it. It's not an overnight fix, but it's definitely possible. So here are some of the causes and triggers. And so past experiences, so negative experiences such as harm, disappointment, or failure can cause the mind to fear a repeat and overemphasize potential risk in the future. I'm going to address that really quick. So, the mind only has access to what has been given. And so if there's been past trauma, disappointment, failures, any kind of issues that come up, right? And you're facing a similar situation, what's going to happen is that your mind will pull back from the old information, push it up to the forefront, and then you're eliciting all of those stress hormones all over again, right? So past experiences is huge. Fear of the unknown. Humans find comfort in predictability, and uncertain outcomes can cause feelings of vulnerability and stress. Another one is cognitive distortions. So your thinking patterns like fortune telling, mind reading, what it is, catastrophizing things, thinking, and polarized thinking can trigger anticipatory anxiety. We have such a creative mind, right? We are the only species that can work on predicting the future and creating things. At some point, we have phones attached in our house. And then someone created the phone where you walk. I forgot what it's called, but for people that don't know, we had landlines, and then one had a cord. Oh, cordless. Then we had the cordless phones, right? Somebody was like, "Oh, it would probably be better if we can walk around with our phone in the house." Then somebody said, "Oh, it'd be better if we can bring our phones with us outside." And then cell phones were created, right? So we have these amazing minds where we can come up with amazing ideas that can create things that can make our life easier. On the flip side, it can also create a lot of harm if we're thinking about things in a negative way, right? So because our mind is so creative, unfortunately, if you're not mindful, you can create elaborate stories about things that may not even come into fruition. And then the next one is perfectionism. So you're setting unrealistic standards for yourself and beating yourself up when you can't meet them, which is hard. And some other factors are anticipatory anxiety can also be driven by anxiety sensitivity, depressed mood. I feel like depression and anxiety are like cousins, or beliefs about one inability to cope with new things or challenges. A lot of times people will tell themselves, well, I can't do that. I can't tell you how many times I hear the word I can't. It's kind of like if somebody was scratching on the board. That's what it feels like to me when I hear somebody say I can't. And it's like, who told you that you can't? We tell ourselves these lies and then we start to believe them and we create so much turmoil. So that's anticipatory anxiety. Again, not a medical condition, symptoms of anxiety disorders. Something like, let's say I said, I'm nervous about taking my test. That's pretty a normal thing to happen. When it becomes this debilitating thing, let's say I get so worked up that I start throwing up, that I say, you know what, I'm not going to take this test, right? When it starts to interfere with your life, that's when it becomes a problem. It's normal for someone to feel nervous about something that's new. right? And let's say this test I'm going to take is in 3 months from today. Like with anticipatory anxiety, it can last for hours, weeks, months, right? And do I want to be anxious like this over a test for 3 months? No. What are some things I can do to work through it? I can study for the test. I can go to the testing site, right? You can use some skills to help you so that you're not riddled with so much anxiety while you're waiting. Another common thing is when it comes to like Sunday to Monday. So people that have jobs like Monday through Friday, they said that Monday morning was the highest rate of anxiety that people would experience on Monday mornings. And the reason why that happens is because Sunday night, and I've talked to people who like have 9 to 5 jobs and maybe they don't really like their jobs. Sunday, they don't even get to enjoy Sunday because they get themselves so worked up that they can't sleep because all they're thinking about is everything they have to do. So they don't even get to enjoy their Sunday. And then Monday happens, and then they're so wound up in stress. You've created this way for your mind to be wound up in stress because of the way you're framing it. One way you can work on that, right, is if Sunday comes, it's like, okay, I have all these emails, I have all these things to do. And then you tell yourself, yes, this is true, but I'm going to do it tomorrow. I'm going to enjoy today. Like you have to be an active participant in your thoughts if you want the way that you've been thinking and feeling to change. It's not going to happen by accident. It's going to be something that's going to happen intentionally. So how does anxiety affect your daily activities? So an anxiety disorder may lead to social isolation, clinical depression, and can impair a person's ability to work, study, and do routine activities. It may also hurt relationship with friends, families, and colleagues. And you know, a lot of the relationship stuffs are affected because you find yourself creating these scenarios about people in your head. And I know this is a fact because I've done it. I've talked to people who have created these scenarios, and the moment I start challenging them, it literally falls apart. Like the scenarios aren't even something that can hold weight. There's no factual thing behind the scenarios. And the simple thing I'll ask is like, oh, what makes you say that? Who told you that? When I start questioning people in that way, it forces them to think, and they're like, actually, no, they didn't say that. And then they'll actually start to realize there's other factors as to why they didn't call back or why they couldn't go or whatever the case may be. But we create active imagination about things that are not true. If you're somebody that have struggled with um, abandonment issues, right? And you have a friend, and your friend may be going through something, and you may know the friend is going through something, but for some reason you make it about you, that the reason why they're not calling back. And you create the scenarios like, oh, they don't like me, or they think that whatever it is you're creating, instead of challenging that thought and says, who said that? Where is this coming from? Some of this stuff is coming from real stuff that may have happened in the past, right? Please save this. Yes, this live is going to be saved. It's stuff that's coming from the past. And so if you're not mindful of the things that are coming up from the past and it's dictating the way you're seeing things, you're going to find yourself overworking and having a hard time sustaining relationships. And it's not just romantic relationships. I'm talking about family, friends, your work people that you work with, your coworkers. So, what are some effective strategies for managing anxiety? Because, you know, anxiety is one of those things you can't see. And unfortunately, so many people are struggling with this and don't know what to do. And unfortunately, people are finding ways to self medicate that is creating more harm, right? Like more drinking you do creates more harm. The more eating you do, it creates more physical harm, right? The more isolation you do, it's creating negative thoughts because the mind, the depression and anxiety, it thrives in isolation, right? Where you're not in community. And so I believe that if we are equipped to understand, if I put my hand over the fire, I'm going to burn the same way we are with mental health. We're not going to find ourselves feeling like we're burning and falling apart all the time. So some effective ways to manage it. So the top ones, it says relaxation techniques, sleep, exercise, self-care, grounding, and support system. Those are huge, so huge to think about these things when it comes to managing your anxiety. If you're when I say self-care, that sleep and exercise goes in that category. When you're taking care of yourself, when your foundation is good, it just makes things so much better. Part of your foundation may be taking vitamins, right? Part of your foundation may be going to bed on time, right? Part of your foundation may be waking up at a decent hour so you're not rushing into work. So when I talk about self-care, I'm not talking about all these glamorous things that where you have to pay for things, because unfortunately, I think that when it comes to taking care of ourselves, if there's a financial barrier, I think we get stuck in that, and we don't start to go back to the drawing board and look at, okay, I may not be able to afford this, or I may not be able to do this, but what can I do, right? Try to work on conditioning your mind to not to, you can acknowledge the barrier, I think it's important, but also look at what can you do despite what you don't have. Remember, we live in a nation that sells us a lot of things, and so you start to believe that those things are holding you back from getting to where you need to be, when a lot of it really starts in our mind. So affirmations are important. So try repeating affirmations like, I am capable of handling anything that comes my way, or I've done this before and I can do it again. I've done this before and I can do it again. It's something I'm constantly reminding people of when they're faced with the situation. And it may not be the same situation, but there's so much similarities in it. And I'll say, well, actually, you just did this, blah, blah, blah. And they'll be like, oh, yeah, you know what? You're right. Right. The more you're intentional about putting that practice into play, it's like blinking your eyes. Like, it literally, for me, it's like blinking my eyes, because I do get that little thing in my stomach where it's like, oh, can you really do this? And I'll be like, yeah, actually, I did. I literally answer it. Like, I answer the question. And then my mind's like, all right, cool. That's what we're doing. But if you're not answering the question, then your mind's not going to be able to do that. It's not going to be able to say that. Um, I think people do see it, the awkwardness. You think people see what? What awkwardness? So affirmations is important. Recognizing anxiety is important. So anxiety and excitement can sometimes feel similar. So try to view your nervousness as excitement, because the same way the fear is in your stomach, the joy and that joy stuff goes in your stomach too. So those similar hormones are being activated, and it's creating this in you. So just know that sometimes if you're going to speak, or you got something exciting that sometimes you're like, dang, I've been planning for this forever and I've been excited, and now I don't feel excited about it. Because it's, you got to tell your mind, like, yeah, it may feel like anxiety or fear, but actually this is excitement, because unfortunately it's in the same area. So that's why I can tend to feel that way. And the last one is problem solving. So focus on what's going well in your life and choose problem solving over excessive worrying. What does that mean? Choose problem solving over excessive worry. I say fear and faith, same thing, right? Both unknown. And so if you choose to stay in a fearful state, and I say choose because if you allow your thoughts to just go rampant and ask all these questions and you're not answering it, you're making a choice not to answer that question, and you're choosing fear over faith. When you start working on problem solving, let me just think of an example. So let's just say I have to speak, and I'm fearful of having to speak in front of a large crowd. And I can choose to be like, oh my gosh, can you really do this? And I can tell myself, yeah. But also when it comes to problem solving, what can I do to make myself less fearful? I can work on preparing for the speaking engagement, right? I can come prepared for it so that I'm not as anxious. A lot of times we're not choosing problem solving. Let's say there's a social event, because I know a lot of people lately has been struggling with like social anxiety and social stuff. And I'm sure the pandemic kind of speeded that up. You spent so much time like being in the house that being back out started to feel awkward. And that was never debunked. So it became like the norm. And so let's say a social event someone wants me to go to, and I'm nervous. What are people going to think? Are they going to see my anxiety? And so I start looping this idea. What if nobody likes me? I'm not going to tell myself, oh, everybody's going to like you. I'm going to be like, you know what? There's a possibility that somebody may not like you, but what does that have to do with me? I literally will question myself that way, right? You have to, like, whatever that is that you're fearing, you got to start naming it. When you name it, it doesn't have the same power. You give it power when you're not naming it. You give it power when you're not challenging the thought. So it has no other choice but to feel real, especially if it's other things in the past that it's able to attach to, right? Your past history, unfortunately, comes to the forefront when there's a similar situation at a bay. And the worst thing you can do is to continue not going to that social event. The worst thing you could do is continue not going for that goal out of fear, because you're feeding the fear when you do that. You're letting your fear know that it's real and it's okay. It's like feeding a hungry tiger, right? Let's say the hungry tiger is the anxiety, and I want to get rid of this tiger, but how am I going to get rid of this tiger if I continue to feed it? I need the tiger to go somewhere else. And so when you don't show up to that event, you're feeding the tiger, right? So one of the things you can do, because action is such a huge step when it comes to anxiety, taking small steps is one of the best things you can do. And I understand that that is very challenging, right? So let me try to use an example. So let's say that you've wanted uh, to start a new job somewhere, and you haven't even like looked online to see what's out there, right? The first, because you're so nervous about it, the first step you can do is go online, looking up that job, looking up what the requirements are. It may elicit some things in your stomach. It may cause you to feel a little bit anxious, overwhelmed, right? That may happen. But then you have to tell yourself, it's okay, I'm safe. The biggest thing that we're not doing is we're not asking ourselves what's going on when these emotions are coming up. And it's not your fault you're not asking yourself these questions. You were never taught. And remember, as children, and this is not no blame to parents, but as children, when something was wrong, if we were, for some households, not all households, if you were sad, if you got in trouble, what are you upset for? I don't understand, what's the issue? Like, nothing's wrong. Aren't you fed? Aren't you clothed? Don't you got all these things? So, you grow up in a system where from early on, any kind of emotion that would come up would be looked frowned upon, right? It would be like, well, and so how could you, if you've never learned how to challenge those emotions or understand what's going on, because you kind of been gaslit from saying like you shouldn't be feeling that way. And so now you're an adult, you're feeling that way, you're feeling guilty for feeling that way, because it's like, well, why am I feeling this way? And so nothing happens, right? Everything just stays the same, and you stay in this loop of having all of these emotions. And so the best thing you can do is like acknowledge what you're feeling, regardless of what it looks like. And you grab yourself a feelings chart, something that looks just like this. For people that are on the audio, I pulled up a feelings wheel. If you Google feelings wheel, you'll find one. You grab a feelings wheel and you start to ask yourself, okay, what am I feeling? That's literally the first step to working through these emotions that are hard. What am I feeling? And then ask yourself, like, why am I feeling it? I don't do rocket science when I work with people. I'm literally asking questions. Best thing you could do is ask yourself questions like, what am I feeling? Okay, why am I feeling it? You may not be able to answer that in the moment. Another way to look at what's happening with you is pay attention to how your body's responding to things. We talked about these symptoms, these physical and emotional symptoms that come up, and people have even named a lot of these symptoms. And a lot of these symptoms that people name, you go to the doctor, you get medically cleared, or you go to the doctor, they may prescribe you medicine. Sometimes they just prescribe stuff so you can, because they realize it makes people feel good. Like, okay, because we in this country, we make things seem like it's a quick fix. So like, here, just take this antibiotic. Like, we don't know what's going on, right? Nobody's asking questions. There are some great doctors that will ask questions, but a lot of them don't have time. They don't have they're not making the connection to you showing up in the ER with chest pains and getting cleared to like, is there anything happening in your life right now? It could be anxiety. Sometimes it takes a few times if you're doing that before they start to be like, all right, like you might be struggling with some anxiety. I want you to really start to think about like these physical things that are happening. And when they're happening, like what's going on in my life? I'm literally asking people these questions, when things start happening, when the migraines start, when the stomach pains start, when the sweat starts, right? And so because I'm asking them these questions in sessions, now when they leave my session, they're questioning themselves and they're starting to see a pattern of like, oh, when I do this, when I meet with this person, my migraines start. Oh, you know what? This person actually reminds me of my childhood because my mom used to do X, Y, and Z, right? So a lot of these things are so connected, and so many of us don't understand that. And so instead of us challenging what's taking place, we're allowing it to have free reign in our lives, and it's creating so much misery. So I really hope this was helpful. You know, if you're somebody that has been struggling with the anxiety, it's like, you know, I put up that anticipatory anxiety post, and so many people felt so seen by it. And that makes me happy that you're seen, because now you know you're not alone. A lot of people have been struggling with these things in silence, because it's like, what do I say? Who do I tell? This like when anxiety is one of the hardest things you could do. I remember this lady came into the ER, and her anxiety symptoms had developed over time because of something that happened at a hospital. Like, I seen the trajectory. And I remember so I would come in to do the psych evals, and then after they were medically cleared. And I remember the nurses were so annoyed with it. But, you know, the medical people, they don't really do mental health. So, you know, they didn't have a lot of patience. And I just felt so bad for this person, because if that's happening with nurses and I'm not saying all nurses are like this, but if that's happening and where these are medical professionals, imagine what's happening in their real life to people that may not understand them, the way they may get gaslit, or the way they may be talked about, because they're living with something they can't see. And so they stop talking about it and they start eating, or they stop talking about it and start drinking, or start shopping, or start hoarding, right? There's so many different ways that people are developing these things because they're just trying to get rid of the pain. And so you can't get rid of the pain just through drinking. In the moment, it does help, but it creates so much more turmoil in your life. And it also prevents you from experiencing joy. And so the best thing you can do is face it. The best thing you could do, if it's the text you need to send the text, because you're, you know, if it's the email you need to open up that email, right? Like, yes, it's going to be hard, but you don't want to start to create a way in a system where you're always avoiding things because you think it's going to help. It doesn't help. If you're always, I wanted to address this comment that someone wrote. I'm never present. I have to think about the future, because if I don't, my life will fall apart. Planning for the future is fine. But if you are finding yourself always living in the future, always worried about the next biggest thing, that's the worst thing you can do, because when you're doing that, you're not present. Being present for me has changed my life. Was it hard initially to work on being present? Absolutely. But I knew it was the best thing for me to do, because anxiety doesn't have space to be in my life when I'm getting into the moment, because in the moment I'm fine. In the past, maybe not. In the future, I don't know. But what I do know is right now I'm okay. And you literally have to start answering your mind and telling your mind that you're okay. So this is going to stay up on all social media platforms, and it will be on the audio podcast next week. Each episode goes out on audio the next week, but there is a new episode now on audio that we did last week. If there's ever a topic you want to hear, you can go to my website, celestetherapist.com, and you can put in anonymously like a topic suggestion, and then we can add it to the rotation. And until next time, beautiful people, thank you so much for tuning in. I'll talk to you later.